Welcome to today's quick healthcare news updates. AI chatbots are revolutionizing the battle to approve costly health insurance claims, achieving in minutes what years of advocacy and healthcare reform have not. Doctors are turning to AI technology, even as some of the country's largest insurance companies face class action lawsuits for using their own technology to swiftly deny large batches of claims, cutting off seriously ill patients from treatment. Some experts fear the prior authorization process will soon devolve into an AI arms race, with bots battling bots over insurance coverage. The process, designed by insurance companies to keep healthcare costs down, has become burdensome. Insurers often demand exhaustive documentation, even for standard treatments, creating a war of attrition. Doctors and their staff spend an average of 12 hours a week submitting prior authorization requests, a process widely considered detrimental to patient health by physicians surveyed by the American Medical Association. With AI tools like ChatGPT, doctors can type a few sentences, and a draft letter is produced in seconds. These chatbots can then expand the letter significantly to address all necessary points, making the process more efficient and comprehensive. Doximity GPT, a high PAA-compliant chatbot, has been effective in reducing the time spent on prior authorizations and increasing the success rate of coverage requests. Since implementing AI for drafting requests, the approval rate for coverage by insurers has significantly improved. Generative AI has been particularly useful for doctors at small practices who often lack the time to appeal an insurer's decision. Nearly half of doctors surveyed by the American Medical Association reported that they did not appeal claim denials due to time or resource constraints. AI has enabled small telehealth practices to appeal more insurance denials, leveling the playing field with larger companies. While AI is still primarily used by tech-savvy doctors, more companies are bringing the technology mainstream. Epic, a major electronic health record company, has rolled out a prior authorization AI tool to a small group of physicians. Several major health systems are piloting Doximity GPT for administrative tasks, including prior authorizations. Insurance companies are also adapting. Insurers have welcomed attempts to streamline the process with AI. Most health plans are evaluating AI for claims review, and some are already implementing it. However, these AI tools may also facilitate billing for unnecessary treatments. As doctors use AI to speed up prior authorization letters, insurance companies are expected to improve their AI capabilities for denying claims. The expectation is that their AI will counteract the doctor's AI, leading to an ongoing back and forth. In the future, advanced AI technology may automate insurance approvals based on the latest scientific literature. Until then, AI provides doctors a temporary advantage in the battle over insurance claims. In other updates, Steward Health investigation. Steward Healthcare, the bankrupt operator of 7 Massachusetts hospitals, confirmed it is under federal investigation. The U.S. Department of Justice is conducting the investigation, and Steward is cooperating, but will not comment further as the probe is ongoing. CBS News first reported that Steward is being investigated for alleged fraud and corruption. Federal prosecutors in Boston are looking into various allegations, including violations of the Foreign Corrupt Practices Act, which prohibits U.S. citizens from paying bribes and engaging in corrupt practices abroad. The U.S. Attorney's Office in Massachusetts neither confirmed nor denied the investigation. Founded in Massachusetts with private equity funding 14 years ago, Steward is now based in Dallas and operates 31 hospitals nationwide. The company expanded overseas, including to Malta, where its deal to manage 3 public hospitals also came under investigation by authorities. Steward is billions of dollars in debt and filed for Chapter 11 bankruptcy protection in May. It seeks to sell its assets through a series of auctions this summer. The outcome of these auctions remains uncertain, and any deals would require approval by a federal bankruptcy judge and state regulators. Steward has faced significant criticism from public officials. U.S. Senator Ed Markey has accused Steward leaders, including CEO Ralph de la Torre, of mismanaging the healthcare system. Markey called for thorough investigations and consequences for the company and its executives. Next, United Health results. United Health experienced a higher medical loss ratio, MLR, in Q2, largely attributed to the Change Healthcare cyber attack. United Healthcare reported an MLR of 85.1% in the second quarter, up from 83.2% in the prior year. Several factors contributed to this elevated ratio. Following the cyber attack, United Health eased prior authorization and utilization management to support provider cash flow. This adjustment led to increased coding intensity once care waivers ended. The insurer also cited Medicare funding cuts, member mix, and medical reserve development effects as contributing elements. The cyber attack on Change Healthcare is expected to incur costs between $2.3 billion and $2.45 billion, impacting earnings by 60 to 70 cents per share. United Health Group remains confident in the rebuilt platform for Change Healthcare, despite early over-optimism about recovery. Despite these challenges, United Health Group reported a profit of $4.2 billion in Q2, surpassing Wall Street expectations. Optum, a key segment for United Health, contributed significantly to revenue growth. Optum's revenue was $62.9 billion, up from $56.3 billion in the prior year quarter. Optum Health saw a 13% increase in revenue, driven by the expansion of value-based care agreements and provider services. Optum Rx, the pharmacy benefit manager, also reported a 13% revenue increase. Additionally, United Health plans to continue its strategy of divesting international businesses, building on the sale of its Brazilian operations by selling its remaining South American businesses. And now the interesting Healthcare Insights segment. In a survey by Philips Corporation, a healthcare technology company, 92% of U.S. healthcare leaders report an increased incidence of burnout, stress, and mental health issues in their workforce. This contributes to staff shortages, as 81% of healthcare leaders reporting delays in care as an issue at their organization. This issue is particularly severe in underserved communities, where patients must travel further to receive care. Healthcare leaders are turning to automation and artificial intelligence for repetitive tasks to reduce the burden on healthcare workers. 88% indicate the use of artificial intelligence to automate repetitive tasks is important for addressing healthcare staff shortages. And there you have it. Please subscribe and hit the like button, and we'll see you again this week.